In this video, we are going to talk about how to improve fertility in men. When we are talking about improving fertility naturally, we have to focus on all the areas which are concerned with imparting fertility. The most important factor is spermatogenesis, and this accounts for 50% of the cases. This is nothing but production of sperms which takes place inside the seminiferous tubules of your testes. And the single most important factor which determines your spermatogenesis is temperature. And for spermatogenesis to take place, you need a temperature about 32 degrees centigrade, which is slightly lower than our body's temperature. That is why testes are present in the scrotal sac, where there is proper ventilatory system which keeps the temperature about 32 degrees centigrade and helps in spermatogenesis, that is sperm production. So if you are someone who works in a very hot environment like workers in blast furnace, or if you are someone who take hot bath frequently, then the chances of increasing the heat around your testes is very high, and that can lead to suppression of spermatogenesis. Also, if you use laptops for long hours, that can also increase the heat around this and can suppress spermatogenesis. So the most important factor is reducing the heat around your testes. So you must wear loose cotton underwears, because wearing bad quality underwear can also increase the heat around this and can lead to decreased sperm production and increase your chances of being infertile. Then comes the role of hormones. So it is directly under the control of your brain. So the most important thing is to keep your brain healthy. There is an axis, hypothalamus, anterior pituitary and testosterone axis. So your hypothalamus secretes gonadotropin releasing hormones, and that acts on your anterior part of your pituitary gland, and that secretes hormones like follicle stimulating hormone, luteinizing hormone, and the luteinizing hormone acts on the Leydig cells of your testes and produces testosterone. So you must keep your brain healthy. How do you keep your brain healthy? Three inexpensive things that will keep your brain healthy are: first is deep sleep. Deep sleep is extremely important for your brain. Second important thing is getting enough sunlight. That will also keep your brain healthy and improve spermatogenesis. Next is engaging in moderate physical activity. Any type of exercise, moderate exercise, will also keep your brain healthy and improve spermatogenesis. Third important thing is blood-testis barrier. Now this barrier does not allow any type of inflammatory cells from your blood to reach into the testis, because if the inflammatory cells or your immune cells reaches inside the seminiferous tubules, it can kill the spermatozoa, because it can cause development of immunity against spermatozoa. So your body is very efficiently designed to restrict any type of bad guys from entering in the wrong area. That is why we have so many barriers like blood-gut barrier, blood-brain barrier, and blood-testis barrier. This barrier also keeps the walls of your testis in a healthy condition and protects these seminiferous tubules. So how to maintain the integrity of this barrier? Testosterone is extremely important in maintaining the integrity of blood-testis barrier. So you must boost your testosterone naturally. How do you boost it? The number one step is to decrease the body fat percentage through a healthy diet, exercise, and supplements like zinc. Then there are other things that are concerned with maintaining the integrity of the blood-testis barrier, like inositol and glutamic acid. So these will also maintain the integrity of blood-testis barrier and help in spermatogenesis. Next important thing is you have to correct any endocrine disorders like diabetes. If you have diabetes, you must control your blood sugar. If you have thyroid gland problems, you must consult with the doctor and correct it. And if you have adrenal gland problems, then again you must go and consult your doctor. So you must correct any type of endocrine problems. And one of the key in fixing endocrinopathies is fixing your gut health. So you must take very good care of your digestive system. Next we come to the duct. So these ducts are nothing but they are small pipes that carry sperms which are produced in the seminiferous tubule to the urethra, and they get mixed up with fluid secretion from your prostate gland, then from the seminal vesicle, and it is discharged as semen during the act of coitus. So if there is any problem with the duct, that can cause occlusion to the flow of sperm. So infection of this duct, or infection of prostate gland, or infection of seminal vesicle, all these can create occlusion to sperm flow and increase your chances of infertility. Then inflammation, especially chronic inflammation of the prostate gland, that can also result in occlusion of sperm flow and decrease your chances of being fertile. So there are things like STDs and tuberculosis which can decrease the chances of sperm flow within the duct, because they cause occlusion to the flow of sperm. Or even trauma or During surgery also, these things, there can be a scar, especially during herniography. So all these things can lead to occlusion to the sperm and increase your chances of infertility. So you must consult with the doctor and get it corrected accordingly. From the preventive measure, what you can do is you can focus on hygiene. Hygiene is extremely important here. Then practice safe sex. Then you can also include certain natural antibiotics like clove, garlic, virgin coconut oil. All these are natural antibiotics, and they will help you to keep this duct in a healthy condition. Next, we come to the coitus problem, where you are not able to perform the act of intercourse correctly, or there is some problem with your copulatory organ, that is penis. So less frequency of coitus or wrong timing of coitus in respect to ovulation can also increase your chances of infertility. Then if you have problems like retrograde ejaculation, where there is problem with your autonomic nervous system, where the ejaculation, instead of happening in the forward direction, it goes in the backward direction and can cause infection of your urinary bladder. So in that case, you may be prescribed alpha adrenergic drugs like phenylephrine or ephedrine. Then you can have problem with premature ejaculation. In that case, you may be given fast acting selective serotonin reuptake inhibitor like dapagliflozin, and this is a very fast acting drug, and you have to take it 1 hour before the act of coitus. Then if you have things like erectile dysfunction, then again there are drugs like sildenafil which can be given. But from natural aspect, what you can do is you can make sure you are not deficient in magnesium. Magnesium is very important here. Magnesium will help you in achieving better erection. It will improve the blood flow, and it will also decrease the chances of suffering from premature ejaculation. So magnesium is the natural thing for all these problems. Another important thing is you can also include a lot of nitric oxide rich food. So these two are extremely important. Next important thing that we want to focus is sperms. So a lot of times what happens that due to increase in oxidative stress, a lot of free radical is generated, and these free radical harm our sperm DNA and can cause decline in sperm quality and affect sperm motility. So in order to protect the DNA of sperm, a lot of times antioxidants and certain nutrients are prescribed for at least 6 months period. So these are the nutrients and antioxidants that can be given to improve the sperm motility and sperm quality and increase the chances of fertility. Out of these, pentoxifylline is actually a drug. So before using this, you must consult with your doctor, and this helps in sperm motility because it decreases the viscosity of blood and helps in sperm maturation. And this is also given in peripheral artery diseases because it improves the blood flow in small blood vessels like in internal spermatic artery. Then we have to focus on the nutrient for your sperm, and it is fructose. So if you have low fructose in sperm, the chances of being infertile is very, very high. So all those people who say that fructose is bad for you are actually infertile people, and all those people who say that fruit is bad because they have fructose and honey is bad because they have fructose are probably using their copulatory organ just for urinating, passing urine, and nothing else. Fructose from natural sources like fruits and honey have never been shown to be bad for your body. In an isocaloric state, fructose is not bad for you. Moderation is the key and will always remain the key when it comes to a sustainable, healthy life. If you like this video, consider subscribing to the channel and sharing this video. Thank you.